All right, everybody, welcome to the channel. Today, I'm going to do an anatomy and physiology review. Just a short one, about 20 questions for you. What we're using today is going to be surgicaltechreview.com. You'll see it in the upper left-hand side. This website has all kinds of stuff: instrumentation review, Mayo stand setup. Most importantly, what we're going to go into is going to be your anatomy and physiology review right here. Once we go in, we're going to use the practice questions. They also have some study flashcards for you. So stay tuned. We're going to get started with some questions. Which bone is not part of the axial skeleton? Sternum, vertebrae, skull, or humerus? Humerus. The humerus is part of the appendicular skeleton, upper limb. The axial skeleton consists of the skull, vertebral column, and thoracic cage. Which part of a neuron receives signals from other neurons? Axon, dendrites, cell body, axon terminals. Dendrites. Dendrites are branching extensions of the neuron that receive signals from other neurons. They conduct electrical signals toward the cell body. Which layer of skin contains blood vessels and nerve endings? Epidermis, dermis, hypodermis, or stratum corneum? Dermis. The dermis is the middle layer of skin that contains blood vessels, nerve endings, hair follicles, and sweat glands. The epidermis, outer layer, is avascular and relies on the dermis for nutrient support. What is the normal resting membrane potential of a neuron? -70. The resting membrane potential of a neuron is approximately -70. That is maintained by the sodium-potassium pump and is essential for generating action potentials. Which hormone is released in response to stress, fight or flight? Insulin, melatonin, epinephrine, or oxytocin? Epinephrine. Epinephrine is released by the adrenal medulla during stress. It increases heart rate, blood pressure, and glucose availability. Understanding this is crucial for managing surgical stress response. Which male organ produces sperm? Prostate gland, seminal vesicles, testes, epididymis. Testes. The testes, or testicles, produce sperm through spermogenesis and testosterone. Each testes contains seminiferous tubules where sperm development occurs over approximately 74 days. How many pairs of cranial nerves are there? 10, 12, 31, or 24? 12. There are 12 pairs of cranial nerves that emerge directly from the brain. They control various sensory and motor functions of the head and neck, including vision, smell, taste, and facial movement. What is a muscular organ where fetal development occurs? Ovary, fallopian tube, uterus, or vagina? Uterus. The uterus is a muscular organ where the embryo implants and fetal development occurs during pregnancy. Its inner lining, endometrium, thickens monthly in a preparation for pregnancy. Which part of the brainstem contains vital centers for heart rate and breathing? Midbrain, pons, medulla oblongata, or the thalamus? Medulla oblongata. The medulla oblongata contains vital autonomic centers that regulate heart rate, blood pressure, and breathing. Damage to this area is often fatal, making it critical during cervical spine procedures. Which hormone is produced by the testes? Estrogen, progesterone, testosterone, or prolactin? Testosterone. Testosterone is the primary male sex hormone produced by Leydig cells in the testes. It is responsible for male secondary sexual characteristics, sperm production, and muscle development. What type of tissue makes up the epidermis? Stratified squamous epithelium. The epidermis is composed of stratified squamous epithelium, which provides protection against mechanical stress, pathogens, and water loss. This multi-layered structure is essential for its protective function. What is the functional unit of a muscle fiber called? Myofibril, sarcomere, myofilament, or fascicle? Sarcomere. Sarcomere is the functional unit of muscle contraction, extending from one Z-line to the next. It contains the contractile proteins actin and myosin that slide past each other during contraction. What percentage of blood volume does plasma comprise? 35%, 45%, 55%, or 65%? 55%. Plasma comprises approximately 55% of blood volume. It is a yellowish liquid that carries cells, nutrients, hormones, and waste products. The remaining 45% consist of RBCs, WBCs, and platelets. What is a clear fluid that circulates through the lymphatic vessels? Blood, plasma, lymph, or serum? Lymph. Lymph is the clear, colorless fluid containing white blood cells that circulates through lymphatic vessels. It is formed from excess interstitial fluid and is filtered through lymph nodes before returning to the bloodstream. What is the function of antidiuretic hormone, ADH? Increase urine production, decrease water reabsorption, increase water reabsorption in the kidneys, or increase sodium excretion? Increase water reabsorption in the kidneys. ADH, produced by the hypothalamus and released by the posterior pituitary, increases water reabsorption in the kidneys, concentrating urine. It is crucial for fluid balance management during surgery. What is the outer covering of the bone called? Endosteum, periosteum, epiphysis, or diaphysis? Periosteum. The periosteum is a dense, fibrous membrane covering the outer surface of bone, except at joints. It contains blood vessels, nerves, and cells important for bone growth and repair. Which gland in males surrounds the urethra at the base of the bladder? Seminal vesicle, bulbourethral gland, prostate gland, or testes? Prostate gland. The prostate gland surrounds the urethra at the bladder neck. It secretes fluid that nourishes and protects sperm. Prostate enlargement can obstruct urine flow and is commonly treated surgically. Which type of bone is the femur classified as? Short bone, flat bone, long bone, or irregular bone? Long bone. The femur is a long bone, characterized by a shaft and two ends. Long bones are primarily found in the limbs and function in movement and support. Which protein is a thick filament in muscle contraction? Actin, myosin, tropomyosin, or tropopin? Myosin. Myosin forms the thick filaments in muscle fibers. During contraction, myosin heads bind to actin, thin filaments, and pull them inward, causing the sarcomere to shorten. What is the space between two neurons called? Synapse, axon terminal, dendrite, or node of Ranvier? Synapse. The synapse is the junction between two neurons where neurotransmitters are released from one neuron and bind to receptors on another. This is where many drugs act to modify neural transmission. What is the structural unit of compact bone called? Osteon. The osteon is the structural unit of compact bone. It consists of concentric layers of bone matrix surrounding a central canal containing blood vessels and nerves. Where do T lymphocytes mature? Bone marrow, spleen, thymus, or lymph nodes? Thymus. T lymphocytes mature in the thymus gland, located in the chest, which is why they're called T cells. They're responsible for cell-mediated immunity and coordinated immune response. All right, that concludes our anatomy and physiology review for today using surgicaltechreview.com. If you guys want to check it out, it is a website that I developed as a surgical tech instructor to help you throughout your program and then again on your CST exam. So we've got instrumentation reviews, we've got surgical technology, Mayo stand setup, anatomy, physiology, we got some of your principles, your procedures, med term, review games, exam simulations, fire quizzes. Go ahead, check it out, surgicaltechreview.com. Thanks again. Follow and subscribe.